So there's a few things. From the timeout point of view, the staff engagement is really important, and we're able to see that through the video monitoring. So everybody's paying attention and everybody's taking a pause to make sure that we have the right patient and the right procedure being done. From an infection control point of view, which is also patient safety, we're watching how we clean the rooms in between cases. Are we cleaning them correctly? Are we spending enough time in there? Are we pulling out everything that needs to be pulled out and really wiping it down? From an efficiency point of view, which is also important, and a physician satisfaction point of view, we're seeing how we turn over the rooms. How long does it take to get the equipment in after the room's been cleaned? How long does it take to get the patient in after the room's been cleaned? And these are important in efficiency and in controlling our own costs. And in the world today, with healthcare reform, we have to find every way that we can become more efficient. The piece that I love about this is that there is no bias. There are times that you start and there are times that you end a task. And that's being done by someone other than our own staff, who may or may not be biased at times to say, okay, there's a reason why this happened, or okay, they did this way because. This is set in black and white. You're either doing it or you're not doing it. And I believe that that's so important when you're looking at quality and how it is that you're keeping a room safe. I have to tell you that my staff has been awesome. They initially had some anxiety that someone's watching them, but when they became cognizant to the point that this is all a quality initiative to just make sure that we're doing the right thing for the patients, they have bought onto this 100%, and you see that in our outcomes. So we are nearly perfect with timeouts.
The WHO came out with a study that was done in multiple countries and multiple centers that proved, beyond anyone's doubt, that by doing something as simple as getting everyone to communicate effectively through a scripted checklist to make sure that you cover all the important basic safety steps that a team may think is important in their center, that you're more likely to actually avoid missing a step, and that will improve patient outcome. We believe that at North Shore Elijah Health System. We believe that strongly. And so we deployed the checklist to help improve our patients' morbidity and mortality outcomes, to make them safer. They're coming to us to improve their health. And by us communicating on basic items like, what is your name? What are you having done today? Do you have any allergies? Are there any special issues regarding this case today that we as a team need to be aware of? We believe that we're making a major impact in how well they do. We can tell already that remote video auditing has helped us reach compliance, 100% compliance with surgical safety checklist. We also know that there's been international studies done in multiple centers that show that compliance with surgical safety checklist improves patient outcome, both morbidity and mortality. Therefore, we believe strongly that by using this tool to reach 100% compliance with surgical safety checklist, we'll be able to show through our research that it improves patient outcome. Sign-outs are important because it encourages communication at a very important period in patient surgery. At the end, we discuss during the sign-out, what have we done? Are there any patient-specific concerns? Have we accounted for all the equipment that we've used in the surgery? And very importantly, where is this patient best served post-operatively?
We learned from the hand hygiene study that cameras and feedback have value. We looked to see what other areas we could use the cameras to increase both safety, efficiencies, and improve compliance with key aspects. And we identified the operating room. From an infection prevention standpoint, there are key elements within the operating room that we would like to assess to make sure that, one, there's key points that are completed. With infection prevention within the operating room, it is essential to have a clean environment. From an infection prevention standpoint, a clean environment could potentially translate to decreased surgical site infections with this environment. So it is a highly important area and needs to be done in a systematic fashion. With remote video auditing and assessing the cleaning, we have seen an increase in compliance with adhering to the tasks as outlined by our cleaning checklist.
Well, the real-time video auditing is an exciting process for me because I've been interested in operating room efficiency for over 20 years. About 20 years ago, we published a study where we had to gather this data the old-fashioned way with clipboards, and there were two big problems with that. The people gathering the data were the stakeholders in the environment. They were surgeons, nurses, and anesthesiologists, and it wasn't objective data. And there was always the question, there were a lot of sort of background motives behind getting objective data. So there was always some discussion about, you know, where are the real delays. In this sense, we have video, we have objective evidence with a standardized clock. The third party is crucial, basically, to have none of the combatants, for lack of a better word, involved in actually the data collection, because people are busy. They can't really keep tabs of accurate timestamps. The video doesn't lie, it's there. Unlike what we did 20 years ago, this project has both the OR efficiency component and a patient safety component. And the patient safety component is very, very important. And that relates to the issues of sign-in verification, timeouts, and sign-outs. Compliance and rigor in doing those pieces has been shown to be essential to patient safety, just like in a cockpit it's essential to commercial aviation safety record, and we'd like to bring that to medicine. We have way too much preventable harm in our hospitals, and this is a mechanism, an extra level of rigor that we can bring in that'll make the surgery safer.
I think initially the staff was a little bit nervous, feeling that somebody was looking over their shoulder, but as they've seen that it's really helped with compliance and patient care, everybody has embraced this and it's really worked out very well. I think the feedback has really been important, that it's helped, you know, both the nurses at the front desk know what's going on in the room, so they know that it's time to get the room clean. Once the room is clean, they know to get the next team in there to set up for the next case. And as far as from the surgeon's aspect, it tells us we can get real-time feedback either from the front board, or we will be eventually able to have direct alerts to our cell phones telling us that the room is ready, so we can get right in for the patient. So minimize the amount of time that the patient is in the room, anxiety-wise, and get to the cases at a faster pace so that the patient has some minimal downtime in between.
The most important thing is that my patient here is safe, that their patient is getting the right thing done at the right time, at the right procedure, the right position. That's all they worry about. The timeout is important for a few seconds, maybe a minute, maybe 45 seconds. Everyone is standing still. Everyone is totally engaged and focusing on the patient. And that's what's so important, because everyone stops. So during the sign out, you're going to ensure that all the counts are correct. So that's how you engage the physician as well. We're counting, we're saying everything is here, everything is correct. We have back all our sponges, all our needles, all our sharps, all our instruments. I get feedbacks from our side for all alerts. I get terminal cleaning feedbacks. I get an instant feedback. If we designated time for doing a timeout, it says 60 seconds. If it goes below the 60 seconds minimum, I get an alert for that room. So that I get more than enough alerts a day. I get 10 alerts a day sometimes to let me know what's going on at any given time. So that way you can go back and get instant feedback to the staff as well.
The benefits of the sign-outs are, at the end of the case, the surgical team, the circulating nurse, the surgeon, and the anesthesiologist communicate to a sponge count, to an instrument count, and this reduces the possibility of retained instruments or sponges in a patient.
And so surgery departments not only account for the majority of the revenues that hospitals generate in a year, but they also have some of the highest risk procedures, as you can imagine, especially as it relates to avoiding wrong site surgery and surgical complications and surgical site infections. So the services that we're offering in this case and have implemented with Forest Hills can be described as really patient safety focused with a side benefit of efficiency improvement. We, as a third-party partner to North Shore, are remotely monitoring to ensure that they are complying with the rules that they have set forth, which essentially mean, is the checklist being used? Is it being used for a long enough period of time so that they're not, going through the checklist too quickly? And is anyone distracted? So the things that we're monitoring for are very important, because if they take too short of a time, that probably means they didn't get through the whole checklist or go through it, calmly enough. And if they're distracted, they're obviously not paying attention, and the risk for some kind of an adverse event could be higher. In healthcare, patient privacy is paramount. The HIPAA laws are very clear, they're very strict, and they're very important. And so as we started to move from monitoring in the hallways for hand hygiene compliance, which was really just cameras on workers and not on patients, and now we have cameras on patients in an operating room, we needed to evolve the way in which our technology works so that we protected the identities and the privacy of these patients. And so the methodology that we approached this with was basically to lower the resolution of the cameras so as not to be able to distinguish anybody's identity or make out any type of body part, but at the same time have it be a resolution level that was high enough so that we could see the types of things that we're being asked to monitor for. And we're very happy to report that we have been able to kind of find that happy medium where patient privacy is completely protected, but we're still able to get the work done for the hospital.